Hello and welcome to this presentation. We will be reviewing a retrospective study on the impact of the Bal-A-Vis-X program on occupational performance of school-aged children with developmental disabilities. The presenters include Nicole Berkty, Addison Cooper, Madeline Dresselix, and Jessica Zerborg, students of occupational therapy at the University of Cincinnati and the College of Allied Health Sciences for the Department of Rehabilitation, Exercise, and Nutrition Sciences. Our mentor throughout this project has been Victoria McQuitty. For background information regarding Bal-A-Vis-X, it is an intervention including balance, auditory, visual motor, and exercise-based activities. This program includes 200 exercises of varying complexity that include repetitive, rhythmic, highly structured exercises and activities that use bean bags and rubber balls. The goal of Bal-A-Vis-X is to address deficits in visual tracking, impulse control, attention, balance, and motor planning and function. So far, there has been limited research provided on Bal-A-Vis-X. We were able to locate 2 pilot studies, one in which was performed in 2008, and it is unpublished in a pre-post test. The sample size included 58 total students who were in the 1st, 3rd, and 5th grade. Interventions were provided 4 days per week, 30 minutes each session throughout the academic year. Key findings were a 20% increase in reading and math scores. The second pilot study was a mixed method review that was performed in the year of 2020. The sample size included 28 6th grade students, and the interventions were 10-minute sessions conducted 2 times per week for 8 weeks. The key findings were statistically significant improvements in processing speed, focused attention, concentration, performance, and accuracy. The study design, as mentioned, is a retrospective design. It is a single group pre- and post-test. As far as the intervention, it was a Bal-A-Vis-X group session that were performed 1 time per week for 10 weeks, and each session lasted 90 minutes. Group interventions incorporated various tasks that included visual motor, ocular motor, and/or bimanual coordination tasks. See Table 1 for a more accurate outline of each session. Activities were graded based on the participants' skills, and the activities gradually increased in difficulty over the course of the 10 weeks. Outcome measures were through the Brunick's-Ostrich Test of Motor Proficiency 2, also known as the BOT-2, which assesses fine and gross motor development. The Canadian Occupational Performance Measure, also known as the COPM, which measures perceived occupational performance in the areas of self-care, productivity, and leisure. And Ann Arbor tracking, which assesses visual perceptual skills, including scanning, visual memory, and visual discrimination. The purpose of this study was to review data from an occupational therapy group that incorporated Bal-A-Vis-X. This study was to determine the benefits of the intervention provided to school-aged children that participated in the occupational therapy Bal-A-Vis-X group. The specific focus areas included fine motor coordination and precision, upper limb coordination, manual dexterity, bimanual coordination, letter recognition, and performance satisfaction scores for personal goals. We had 29 total participants, 24 male and 5 female, with the age range being 8 to 12 years old and the mean age of being 9 years old. The occupational therapy Bal-A-Vis-X group took place at an outpatient center at Cincinnati Children's Hospital Medical Center over the summer of 3 consecutive years. The participants were patients exclusively from Cincinnati Children's Hospital who participated in occupational therapy, and they had to have a diagnosis of developmental delay. The data analysis. It was a quantitative data that was retrieved from the electronic medical record, inputted into Excel, and then exported from Excel into the SPSS, which stands for Statistical Package for Social Sciences. Demographic information was analyzed using descriptive statistics to provide information about the study sample, and then data from the COPM, BOT-2, and Ann Arbor were then analyzed using pair samples t-tests. The results are as follows. The BOT2 had significant improvements that were noted from pre-test to post-test data on all 5 subtests. See Table 2 for more information regarding the BOT2. It is noted that each subtest received a p-value of at least less than 0.005. The COPM also had significant improvements that were noted from pre to post-test data on both subtests. Both the performance and satisfaction scores received a p-value of less than 0.001. Please see Table 2 for more information. Ann Arbor tracking was also based on pre and post-test scores, and there was a 6.6 increase on average in letters children could recognize. Please see Table 4 for more accurate information, and it is noted that the tracking for Ann Arbor received a p-value of less than 0.001. For discussion, it says that the BOT2 results suggest participants in Bal-A-Vis-X improved significantly in fine motor skills, bilateral coordination, and upper extremity coordination from pre to post test. Ann Arbor tracking yielded positive results, with children having a noted improvement with letter recognition. Clients and caregivers also reported improved performance and satisfaction with goal areas in the COPM when Bal-A-Vis-X was incorporated into traditional OT interventions. Results of this study did align with the 2 previously mentioned pilot studies, which exhibited positive outcomes utilizing Bal-A-Vis-X as an intervention. Throughout the study, Bal-A-Vis-X was incorporated within an OT group intervention using a variety of different other interventions. Therefore, it is difficult to determine if it was the complete OT intervention or the specific components of Bal-A-Vis-X that contributed to the positive change. During goal assessment and standardized testing at the end of the program, all participants showed improvements compared to baseline scores. Limited research has been conducted on the efficacy of combining interventions in a single treatment program. Further research should be conducted regarding Bal-A-Vis-X and its efficiency when utilized with different age groups and populations. To further explore the benefits of Bal-A-Vis-X, it would be useful to trial the program with a variety of common pediatric diagnoses. The 2 main limitations is that this study had a lack of a control group, and it was also a retrospective design. Secondary limitations were that it lacked homogeneity, which was a variety of ages, diagnosis, and goals, and Bal-A-Vis-X was used as just one of many other interventions with the participants. In conclusion, the results of this study demonstrated that school-age children benefited from participating in an occupational therapy group that utilized Bal-A-Vis-X as part of the intervention. Improvements were noted with children's motor skills, letter recognition, and with parent-child functional goals identified for occupational therapy. With these positive changes in the specific outcome areas that incorporated multisensory exercise-based interventions, it appears that it has a positive effect on children with developmental delay. More research needs to be conducted for further evidence regarding the efficacy and the efficiency of Bal-A-Vis-X. For a complete list of references, please scan the QR code below. Thank you for listening to our presentation and have a great rest of your day.